While we're waiting for other folks to join, if anybody else is coming, perhaps we can just do a quick round of introductions. Um, and and it sort of feels like I'm not alone. So I was thinking that perhaps for introductions, we could just you could share your name if you'd like to share your pronouns, the organization you're affiliated with, and if perhaps you want to share with us all some way that you love to, something you like to do that helps you stay regulated. I feel like in lots of dysregulated moments these days, and I have some things that I like to do, but I like to get ideas from others. So maybe we could share a little bit of that. I can, and or you can share whatever you want. I guess I'm just offering that up to you all. So I can start. I'm Liz Blackwell Moore, she, her pronouns. I'm the director for Cumberland County Public Health and a member of the council, the Maine Recovery Council. And my favorite thing to do when I need to like pull it together is to walk in the woods. I have some woods right out our backyard. I can open a fence, a gate, and walk right out into these woods that go down to a river. And it's just like was out there this morning and it was amazing. And it really helps quiet my mind. How about I go to you, Melissa?
Thanks, Liz. Hi, everyone. Melissa Hackett, she, her pronouns. I do policy work at the Maine Children's Alliance, and I'm the coordinator for the Maine Child Welfare Action Network. I would plus one yours, Liz, but I think that's kind of lame. So I'm going to go to my backup, which is that I am fortunate enough to have a very long term friendship with someone who is a yoga instructor, and she developed a 30-minute morning yoga routine that I like to do every day. And I remind myself that I live in a body and a nervous system, and I breathe and I stretch, and I really try to start my day that way.
Okay, I'll just keep going. How about I'm going to go in the order in which you are on my screen. How about you, Gay?
Gay McDonald, I'm the executive director of MadSAC. She, her pronouns. And the ocean regulates me, but because I live in the northern Maine woods, that is not something that I often, it's quite a drive to get to the ocean. Um, I think as a former teacher that it's conscious breathing because things change rapidly. And I need a strategy that I can do right then and there and anywhere. So that's what I would say.
Katie.
Katie Haas, she, her pronouns, and I'm a special ed director. I'm actually at Spurwink. You probably can see behind me, only because I was here for a different meeting, not because I'm working here. I do work in a public school. Just grabbed a conference room. And I think, I go to the beach year round. I live about 15 minutes from the ocean. And so whether that's going to the beach just for a walk or driving by and rolling my windows down, I think that's just, it does sort of keep me grounded when I need to be.
How about Carrie?
Good afternoon, everybody. Carrie Woodcock, Executive Director for Maine Parent Federation. We are the Parent Training Information Center and Family Health Information Center for the state of Maine. Um, I learned during the pandemic when everybody was home with me, because my husband's also a teacher, that instead of working out in the mornings, I was going to intentionally schedule my time to work out away from the home in the afternoons. And I have kept that routine because things are not any less crazy, and I can sit in my little chair in my bedroom, which is my office, for hour after hour and meeting after meeting. So whether it's a walk with the dogs or a quick jog outside, I get out and do that sometime in the mid-morning, early afternoon, so that I can have an hour away from my computer. Otherwise, I'd be here forever. Can I hijack for a quick minute? Because I just had some news this afternoon around the funding of IDEA, and there are a lot of educators, but also secondary college programs like the USAID, which will be impacted by this. The Labor H bill out of appropriations, which Senator Collins is the sponsor for, does not include funding for IDEA Part D. It does first part B and C. Yeah, I saw you, Gay. Oh, yeah, that's the reaction I had today. We were not aware of that. If you don't mind, I'm going to put Mark Leduc's email address in the chat. He's the contact for Senator Collins around education and appropriations. Anybody who wants to can send a short little email asking Mark to ask Senator Collins respectively to include Part D in the language in that bill. That's PTIs, that's your USEDS, that's your LEND program, that's parent training through the Department of Education, and that's also our technical assistance for every grant. So it literally impacts every aspect of education for our families.
Can I
So
just before you share it? So I haven't had a chance to introduce myself. I'm with the AG's office. I'm kind of the lawyer for the Recovery Council. Um, Before you share that email, can we do it in the opposite way? Anybody who would like to receive that email, put your email, like get your
Yeah.
email to Carrie, or put your email in the chat, or however you want to get in touch with Carrie, and then Carrie can share that information with you.
thanks, Brendan. Yep, thanks.
Thanks. Atlee.
Hi, everybody. I hadn't heard that either, Carrie. Thank you. Atlee Riley, I'm an attorney at Disability Rights Maine. And I'm a proponent of leaving a hammock up year round and utilizing it year round, even for very short bursts.
Love that. Thank you. Brendan.
Well, now you all know who I am. I'm with the AG's office. I am not a member of the council. And when life with the council or the AG's office gets too much for me, I really like to go visit Maine's state parks, which takes me to all different kinds of geography, terrain, ecosystems, all year round. Scarborough Beach has great pond skating, when conditions are great for it, for example. Anyway, that's what I like to do.
Sarah.
Hi everyone. I am the only Sarah, right? I'm not.
Yeah.
That rarely happens.
Right.
I'm Sarah Wilkinson. I am a faculty member in the special ed department at USM. I was a minute late because I couldn't find the link, but I'm sharing what I do to de-stress. Is that true?
Yeah. Great. Perfect. Yep.
Great. I also like the beach year round, and I mean I live a quarter mile from the beach, so that's very easy. But also I kickbox many times a week, and I've never hit another person in my life, but I really like punching the punching bag and kicking the bag.
Awesome. Love that. Thank you. Nancy.
Hi, I'm Nancy Cronin, Executive Director of Maine Developmental Disabilities Council. And one way I'm hoping that people will know me as the crazy dog person. I have my dogs with me all the time. They are always either in the car or right now they are here at the office. And I find that they ground me because, one, they remind me that I have to get up. If not, I totally forget to get up. So they force me to get home because that is where their dinner is. And my stress relief when I really need to get out is walking them. And I like dog parks too. Dog parks are really grounding and they're hilarious. And you find very different stories there. So it allows you to kind of walk out into the world. So if it's not outside with the dogs, it's going to a dog park and listening to whatever chatter is going on with whoever is there.
Wonderful. Thank you. Elizabeth.
Hi, sorry to have my camera off. Like Nancy, I like to think that my dogs are the crazy ones. I have a dog who's a little less than 2 years old who eats live crabs at the beach. So that keeps me very entertained when people are horrified at the beach that she is eating live crabs, which is like her favorite thing to do and somehow does not make her sick. So yeah, I don't know that it de-stresses me, but it's pretty entertaining to a lot of people to watch her do that. So, and she's in here now thinking that everything is about her. So,
Can I jump in real quick? Erin Fraser has been trying to join. I forward her the link. and she didn't get it, but I think she's getting in. Is she sitting in someone's waiting room, whoever's in control of the Zoom?
I will promote her. Yes, she's
Okay,
in the.
thank you.
Thank you. And Chastity.
Hey everyone, Chastity Toole. I use she, her pronouns, and I'm the executive director of the council. Um, I mean, everyone's already said it, the outside. I'm near the water too, so being able to get out to the beach or just along the trails where they ripped up all the old railroad trails and they're like walking ATV trails, that is the best, especially alone. Those times alone are wonderful.
Nice. Erin, thanks for joining. Sorry it took us a little bit. We're just introducing ourselves, and you can share what your affiliation that you're with, and perhaps sharing something that you do to sort of stay regulated, during difficult times.
Oh gosh. Okay, well, I'm Erin Fraser. I'm the director of the Office of Special Services and Inclusive Education at the DOE. And I meditate. That's what I do.
Thank you. Well, I said earlier with some people on the line, I'm really appreciative of you all showing up. This is a Friday afternoon before a long weekend, and it's been a long week. So I just really appreciate you all being here. We on the agenda today have a couple things. The first is to review some of the challenges that we all talked about in the last meeting and some possible strategies, and do some adding if there are some additional strategies. I also realized that we haven't really talked about or put a place in for some of the evidence, some of the research, or some of the ways in which we know these are good strategies. So we may actually ask you to do that after this, because I don't necessarily have all of that, and I'm sure Melissa and I don't have it, and so we would love to pick your brains for you to put in some of that. Then we're going to have an initial discussion on the initial prioritization, just get a feel of where we're at for what people feel like could be some of the high priorities strategies. I think that's just to start us down a road of okay, what else do we need to gather? Whatever other information will we need to have in order to really prioritize? And I think this discussion and the prioritization, we can talk about what are the priorities that are outlined in the MOU. We can talk a little bit about the RFP that was put out by the national settlement folks to see what are some things there we want to think about. Melissa's going to share with us a little bit of data to help us think about how do we prioritize the most impacted schools. And then we have a couple of questions for kind of consideration for the RFP process. Does anyone have any additions or questions they want to ask before we get started here? I've shared a Google Doc with you that I know you've all received, but I'm just sharing it with you again because I think sometimes people like to see what we're working with while we're doing this. So you can all open it yourself, and you can take some notes right in here. So I think just to start, I think it would be great if we wanted to go. I think there's 5 challenges. So if we just go by challenge and see real quickly if does it help to go through them in order, or do people just have additions or questions or things they want to ask people about possible strategies? I think I'll offer, let's go in order. First challenge, higher intensity and higher quantity of students with behavioral health challenges may lead to more families feeling that their children are being pushed out. So we have a couple of possible strategies here. And I wonder if folks want to speak to any of these or have some questions they want to ask or any additions. And with Zoom, I feel like please just speak up, or if you feel like you need to raise your hand, please do, but also just chime in.
So when I was looking at that, I was thinking some of those challenges, which I just lost that sheet. If we're thinking about strategies and solutions, something our group might want to think about is if you talk about training, and if you're thinking about using funds um, for training, I think it hits a couple of these different barriers and challenges. If you focus on training for school personnel working with students with disabilities, that goes along the lines that really the intent of this appears to be for the funding for schools, for special education services with a preference to age 8 and under. And so I think if some of those may be able to be grouped together or repeated, because I do think when we talked about our last meeting and talking with directors across the state, there's a huge need for trainings at the school level, consistent training. And so I kind of think maybe it could hit in a couple of different places.
Mhm.
I don't have a problem with that. I think it's a good idea as long as we add technical assistance. When we look at implementation science and success in implementation science, training in and of itself doesn't change behavior. That only changes behavior 5% of the time. While if you add some technical assistance of how do you do that in the actual classroom, how do you change the behavior, how do you like getting the help, that's when actual change becomes sustainable. So if we look at technical assistance as well, I'm cool with that.
Yeah, and I think when I say training, it's not professional development, right? Necessarily, it's school level ongoing training, coaching in the school, working with the people who are providing services for students.
Right, and I think
Thank you,
to
Nancy.
what, yeah, and to what Nancy's saying, this this idea about a train the trainer model, so that there is that embedded technical assistant, that ongoing coaching that happens. It's not just, okay, let's sit and get a PD conference or something and then go back and how much of it is really used, but that ongoing kind of train the trainer model so that we have trainers on, in schools who can kind of see this work through and problem solve as as there are wrinkles and as things come up that are challenges. So Gay, I agree that I think that sort of this idea about targeted train the trainer kind of work, meets the building capacity and also Nancy's point about, the ongoing technical assistance.
Great. And then the other one is connection to community resources, recommend replace with interagency partnerships between schools and community providers. Would someone like to speak to that one a little bit?
Can you say it again?
There was a second strategy, and I'd just love to get a little clarification on what whoever wrote that. Did we write that? I feel like somebody added this one. It's connection to community resources, recommend replace with interagency partnerships. Oh, I think somebody's recommending that we replace it from saying community connection to saying interagency partnerships between schools and community providers.
Yeah. And Liz, I think there was a similar recommendation in the prior strategy, right? I think somebody went through and
I see.
said, let's reword these things. So I
Got
would
it.
also welcome folks saying, does that substitution make sense? My read of that was some of the language changes would more align with some of the suggested uses. So
Totally. I think that makes sense. Do folks feel okay? So I think I heard from like four of us that we feel, or three of us that we feel okay with changing classroom management skills to targeted intensive training for school staff. So I'm going to make that. Does that thumbs up on making that change? Great. Can folks see what I'm working with here on this Google Doc? Do you feel like you need? Okay.
Can I ask a clarifying question?
Yeah.
I'm just thinking, about the word school. And, I'm thinking that this work also will encompass our special purpose programs that have children that are highly impacted by these things. And so I just wonder if we should think about maybe we just have to like keep that in the school, but I don't know if we have to kind of clarify that because I think the SAUs are all responsible for the children who are outplaced, but we want to make sure that that technical assistance reaches the outplacements as well, so that we make sure that that is not a group that's neglected in that work.
I think
Can
that may be a
Aaron,
question for Brendan to clarify, right? We're about the receipt of those and use of those resources for those particular schools.
well, I guess can I ask a real quick question before Brendan answers that? Aaron, I guess I'm wondering if because the MOU says really clearly it's for SAUs. So if it was changed to targeted intensive training for SAU staff, do you think that would encompass the people you're talking about?
It, I mean, again, obviously, I hadn't thought about that. All of the SAUs are contracting with these agencies to provide services, and this is one of the most highly needy population of students in our state. So there most likely is some overlap, but I think that it can be kind of delivery approach could be through the SAUs reaching out to those students. The problem is with doing it that way is that 17 different SAUs send to one special purpose school. So that's a little bit confusing. I just think it's just something that we should kind of think about. There probably is a solution of how it can be through the SAU and filtered to that population.
And that can be, to the extent this is part of the RFP, that can, there can be something about inviting the applicants to explain how they would do that.
Yeah, I was just looking at that draft RFP this morning, Brendan, and I think there was an emphasis on actually some of the suggested priorities around working with community partners to bring in services, but that the funds would go to the school and then be distributed or allocated as appropriate. So that feels in alignment with that.
Yeah, the key requirement is that it's the SAUs that can apply for the money, not individual schools. But you can certainly require the SAUs that apply to explain how they would, work directly with specific schools or anything along those lines. Does
Liz,
that help? Okay.
Liz, I don't know if you saw my message, but Sarah Wilkinson got kicked out. She needs to be promoted again as a panelist. Thanks.
I think hopefully Elizabeth is working on that.
We just promoted her.
Great, thank you. Okay, so I added in a school/SAU. And I think that's a great, thank you for bringing that up, Erin. I would never have thought of that, so I appreciate that. I'm wondering how people feel about the possible strategy for this one, having it be interagency partnerships between schools or SAUs and community providers. Do people feel good about that change? Okay. Are there any additions to this challenge that anyone would like to make for additional strategies that you feel like could be important to addressing this particular first challenge?
I think the one thing that I would say is going back to that targeted instruction, that Nancy's language really hit home the need for technical assistance for implementation. And so we might want to use some of that language to ensure that there's a clear understanding. It's not just professional learning or training. That means in the implementation of working with students with disabilities with an impact.
You feel free to go in there if you feel like this doesn't quite hit it and add the language. I think that I think what we can do too is like have some time to think about some of this. And if there's wordsmithing we need to do in between, especially I found that we did this last time in the prevention work group, as we kept like talking about and getting to priority strategies, we kept kind of wordsmithing what is like the actual intent of what we mean. So keep that, and let's like keep holding on to that to see how we wordsmith to make sure we're getting really clear. And I think if we have some evidence and some actual research or that you want to add that's about what that training and technical assistance looks like, I think like Nancy, you putting in that piece around like training is only 5% effective, but how do we have the information about technical assistance being so? I mean, we all know how much coaching and TA is really how changes happen within schools, like some deep work there. So like it will be helpful then to have the research with that.
So we'd be removing this language here, just the basic classroom management skills and replacing it with this more targeted intensive.
Correct.
Okay. Yeah. Should I strike that out, or should we? I don't want to.
I have it changed. I'm not sure
Oh,
which
okay.
document you're looking at. Maybe you have a downloaded version. Do you have the one that's like we're working on in real time?
Yeah, I have people in here, 8 viewers, and I did see what Gay typed in, but I don't know. Okay, that's fine.
Can other people see what I've typed? This is good. No? Oh, interesting. Huh.
I was working off the link that you just posted
Yeah.
in the chat as opposed to maybe yeah, I don't know if there's a couple of links or not.
No, there's just that one, and I can see my own changes and that you all are in it. Melissa, can you see what I'm doing?
I think I see what the problem is. The table's in yeah, Sarah's saying it
Oh,
too.
the table's in two
The
places.
table's
I'm
in two
down at the
places.
bottom one. I'm
So
so
scroll
sorry.
down to meeting number 2 and the table there, and we should all be in the same place. The table's in two places.
Sorry about that.
No, that
No,
was good
that's totally
clarification.
on me. That's on me, Katie. I'm sorry. I should have told you all I'm on this different one. So because well, now I'm gonna have to do a little differently. I started like I have a down below when we start to prioritize. I took the already strategies we had and put them in there. So I was using this other table, other additional, so that I could copy and paste pretty easily. But it doesn't matter. We're gonna wing it. We're gonna work it on the fly. Okay, so how do we feel about moving on to the next challenge? Are we okay with that? Okay. So identification and misidentification of exposure and trauma and how that translates into special education. Some children are being misidentified with diagnoses and then interventions are not meeting their needs. So we have 2 specific strategies here around training for school psychologists and better tools for identification. Did folks have any thoughts on these, additions you'd like to make, questions you want to ask?
I just, by the way, I just tried to change something in there because the data that you wanted was here and I couldn't. So
Okay.
I personally find it hard to be somebody who I can't listen and type and read at the exact same time. It gets really hard. But I
No
just
worries.
wanted to say that I tried. I tried and I'm giving up.
That's fine. Put it in the chat is great. And we will keep, there are 3 of us who can keep putting things in.
I think a note for the group in looking at this strategy is, which I think you've alluded to already and said the evidence. Because if there aren't valid evaluation tools for the use of this, then I wouldn't want to be recommending that there be funding for that if there's not valid evaluation tools to use to identify students in regards to this. And I meant to research it further to see if there were or were not, and I did not have time. So that would be my only caution, I think, with that is making sure that we're not putting something out there that sounds good, but it's really not in practice yet, or it hasn't been vetted.
I think that's a
Appreciate
really
you.
important point. Okay. I agree. I worry a little bit about what is out there and how valid it is, even if it looks good. I'm curious about the real validity and reliability of those tools.
Yeah, and I think Lisa Backman from MASP, the Maine School Psychologists Association, was going to take a look nationally to see if anybody had anything out there that they were using, and then get back to at least get back to MadSec.
Okay. Thanks.
And I would just say, I appreciate as we're rolling through these recommendations, I appreciate these kind of granular details and believe that the council will appreciate that too, of like, what does a good example of this look like, and what sort of components or criteria would we want to see in proposals that reflected that. So anytime you think of that kind of level of detail, it doesn't, examples of models or programs are helpful, but even just like what are components of a good program or model, I think would be helpful in the sort of scoring evaluation of RFPs that might include those kinds of proposals.
I think just to follow up what you were just saying, Melissa, I know this appears in a couple different challenge rows, but back to that first one about sort of the um, targeted training and technical assistance. Um, the I know, and I could cite it in a minute, but I know that the components there that we really do want to see is that it requires, well, the evidence-based pieces of that are coaching and performance feedback.
That level of detail is really helpful. And also, you don't have to have it right now. You could just say, like Gay did, let's just think about what evaluation would look like, and
Okay.
then follow back. So
Yeah, I know
appreciate when you
I
have
know
it.
how to find it. I just don't have it handy at the
Yeah,
moment.
yeah, yeah. Appreciate if you have the top line. And then again, this is a first pass at this. We're going to come back at our next meeting. This is really an opportunity to make sure, do we still agree with these as the challenges and strategies? Are we missing anything before we go into sort of prioritizing? So this is not the last pass at these things.
Great. So how about we move on to the next one? Getting the resources for children getting the resources for children is impacted by parents who are struggling with current or past addiction, worrying about shame and blame. And two possible strategies there are parent advocacy training for IEPs, peer, and there seems to be a question with that one, and then peer parent support for enhancing parent engagement. Recommend resources for schools to provide parent training and engagement, and resources to families impacted by OUD. So that was like a little more specific. So changing this to resources for schools to provide a parent training and engagement, and resources to families impacted by OUD.
What would this look like? What could something like this look like? I wonder. Because training for IEPs is one thing, but is that necessarily what we're getting at? Are we trying to just or are we getting to a higher level of having people understand that behavior challenges can be as a result of these things, and it's possible that moms didn't even know that they were pregnant, something kind of bigger to kind of prime that they might be willing to have a parent support or parent advocacy. I'm not sure that initial piece will get them in the door for parent advocacy training or parent support.
Right, and I think that second bullet, would be more about the piece that Atlee was talking about around, parent training and engagement is one of the aspects of an IEP, right? And so do schools have the tools and resources, or the amount of tools and resources, or the right tools and resources to do that sort of parent training and engagement work with families who have been impacted? by OUD? And also, are there other resources that we can provide to them in terms of raising awareness or so I think, and again, I'm not sure what is out there, but um it felt like an area that could directly support parents and schools in engaging together around this.
So obviously parent training is what we do, and we already do IEP training. It's not specific to those that have been impacted, um, or who have children who have needs based on any sort of drug or alcohol exposure. Um, I don't know that it needs to be specific to that, other than, the qualifying criteria around special education. We also have our peer-to-peer support program, Family Support Navigator program. I can tell you when we go into schools and we're working with parents, most districts at this point know who we are. When we leave, they're asking for cards because we're working with parents to work with school districts. So, I mean, when violations take place, we let families know, but we also work on compromise and not and trying to come to a reasonable result for the student.
Right. Right. I guess I was looking at the second one more specifically because I agree, Carrie, that the first one, I don't know. I think that there is, Maine Parent Federation and other places do provide parent advocacy training for IEPs. And so I don't know if that is really as specific to this work, or just maybe overall important.
Yeah, I mean, it's not specific to OUD. And to be honest with you, we don't have a lot of inquiries um, from family. I mean, where we get the inquiries are from foster families or adoptive parents. Those are the parents who will reach out to us. Otherwise, the stigma prevents families from reaching out to us. Um, There is also a statewide family engagement network that we have here in the state of Maine, statewide family engagement. And Aaron, I don't know if that's why you're raising your hand, but they're working on family engagement with schools in our state. So that could be a resource to tap into. And I'll shut up and let Aaron contribute.
Um, this is directly the work that I'm doing with the researcher in the University of Rochester. And we have 10 school counselors that are getting trained up in providing support for families in using an app from a evidence-based fetal exposure syndrome disorders. So there is a very highly regarded evidence-based parent training and format out there, and we're partnering with that. So, one thing that we could do, if this group is open to it, and I don't know if it would be like, potentially outside of this meeting, is to learn a little bit more about that and what that entails. The work that's being done right now, we have 10 counselors that are getting this training for free. And then we'll get oversight over the years. So to your point, Nancy, it's not just like you get this training and then we hope you can use it, but it has a targeted resources for like making sure people are utilizing it effectively. But if people are interested in that, that is something that I'm trying to bring in the state, which would help for also screening for exposure disorders and also, kind of trying to reduce the stigmatization around it. So again, that might be an offshoot of this meeting, but it is work that I'm certainly right now doing because of the large impact of this in our state.
That feels like work that would be evidence-based and timely and could really expand if there were some opportunity for some district funding and then expand to the point where it grabs some traction in districts so that that initial startup cost is gets people trained and using this app and doing this work so that then it's not an ongoing, maybe as much of an ongoing cost, but that sounds like a really interesting possibility if schools wanted to write an RFP, or write a grant and we were to, that might be an interesting, I could see that kind of falling really well into this challenge and into this pot of money to kind of expand that work, Erin. I wasn't aware you were doing
So for this one, I'm wondering if then it sounds like the parent advocacy training wouldn't necessarily come from schools. Like maybe it comes from other places, right? It's already being offered. It's maybe is like a resource that becomes, but isn't necessarily a strategy for this to for this in this space. Do people feel okay with me removing that top bullet,
Yeah, yeah.
but keeping the bottom one around perhaps this one around resources for schools to provide parent training, engagement, or resources, or something where we flesh out this one, the second one, a little bit more? Okay, seeing no negatives, I'm gonna get rid of the first bullet. Are there some other questions or things we have about this? I mean, it looks like people had, it originally said peer parent support for enhancing parent engagement, and then the recommendation was to change it to resources for schools to provide parent training and engagement, and resources to families impacted by OUD. And then this training app is really more around school counselors and having them have the tools to work with parents in a better way. I guess I'm not sure how we want to align those pieces. Do folks have thoughts on that? If it's a totally separate bullet from this one? That's really around equipping schools with more tools for engaging with parents around young people who may have been exposed as infants, or I mean, it sounds like, is the app, Erin, available? Would it also be supportive of folks who just have had children who've been experienced trauma related to the addiction that's in the family? Or is it really more specific to
It's
fetal
really more
exposure?
specific to the behaviors and challenges, cognitive, emotional, for children that have, and how to kind of effectively accommodate and supports around that. However, again, and I've come to learn in my work with this researcher that the intervention supports and instructional support for those syndrome disorders versus, like another health impairment or an emotional disability are very different. And these are very specific. Because really you're working with a brain injury, and it's different than a learning disability or an emotional disability. So it is, again, it is right now. So this evidence-based program that's used widely has been in Maine. There's a pretty active group of people who work on FASD in Maine. And so there are people that are trained all over the state in this program. So this research opportunity that's happening right now, where 10 school counselors are having an opportunity to be engaging families with this work, is they've created a parent training module based on this evidence-based program. So they're now researching this. So this is kind of the research stage, but it is like this, they have been doing this for several years and it's been found to be very effective. So it is, I think, a great tool and can be. They also make something for educators, which is really a great tool because, again, many educators might see a behavior and or a learning style and think that's, maybe it's a willful behavior, or maybe they're just choosing to do that, versus really understanding the underlying causes of behavior. So yeah, I haven't actually looked at although I know the evidence-based program that they're working from, and some of the applications here, it is kind of specific to the behaviors and disruptions and activities that, would be happening in the home and how parents can support that and understand the behavior versus, potentially misinterpreting the behavior as being, not stemming from the cause of it, I guess. That makes sense.
Mhm.
Can everyone see the way Liz has sort of refined those 2 points? I'm curious if in my mind, there is somewhat of a distinction. Someone might propose something that would capture both of those, but I think it's sort of like what is about the engagement with the parent or the parent being equipped with an understanding, and what is sort of more about school personnel and staff, and those being sort of two discrete bullets. Again, something might try to capture both of those pieces, but they feel like different enough pieces to capture separately to me.
I think it looks great. I agree.
Okay. Okay, so if there's no additions to this one, we can move to the next one. I want to pause, just make sure. For some people, operating this way on the fly is not easy. So I just want to say again that you will have time to like sit with all of these before we do more next time. So I know some people are crackpot thinkers and this isn't the best way in real time. So the next one is lack of training and support for school staff on how to work with students with serious behavioral challenges. This one perhaps isn't much different from the first one. I guess I'm curious what people think about how is this challenge different, and have we addressed the part in the first challenge that was around pushing kids out? I sort of had some questions about that, but because we didn't address the active push out part in the first one.
I wonder if that's a question about some higher intensity needs. If that's the distinction, would welcome others to share. That's how I read that.
Got it.
Well, and from our lens, MadSAC, and then also working in public school, if you have, I think the push out of students and parents are feeling that if you don't have staff or you don't have staff trained at an appropriate level of training, I think that's where you're feeling, parents feel that students are being pushed out because the school doesn't have, and teachers are probably at a loss because they don't have the training. Like a lot of us are on a lot of meetings and different places and sit around and say they don't have the training that they need. So I think if SAUs provide that training and implementation, you would hopefully see parents feel that a higher rate of inclusion for their child. And so when I look at these, I kind of see that they go hand in hand. If you have well-equipped staff working with students, even at high levels, then that's a better success rate for everyone. So I think in training school personnel, or in anything, if you're training and truly training, they're better equipped and they have maybe more recent evidence-based strategies that they're using than what they used to use, better identification, that they're able to provide a higher level of service to a child.
So, Gay, am I understanding correct? Like, do you mind if I just sort of then say, are you thinking that then these are kind of similar in that there's really just a broad lack of training and for classroom management, and also this like working with students in general with serious behavioral health challenges, and that this targeted intensive training kind of would solve for both of for those who are in special education, but also for anybody in the school system?
Well, yes, because if you, whatever special education, students who have special education are general education students first. And
Right.
they belong in the school, they belong in classrooms, they have services through special education that they need, but those strategies and that training and that skill set is good for all students. But I think when we're really focusing on OUD, there is a significant lack of training and identification of students in this certain group that we're looking at. And higher rates of opioid use, are those equivalent to these some of the behavioral challenges at a higher level than what schools have seen before? And then the push out of school, that's an IEP team decision, the student's placement. So, but I do go back to that. Yes, if you have training for all school staff, then they will be better equipped. There's not a lot of discussion out there about the topic that we're talking about in schools. They're talking about behavior and mental health concerns, but not focused here in the identification and how is that different, like Aaron was just talking about, brain injury, right? And fetal alcohol syndrome. That's that's not a focused area. And so you can, when I talk about training, I'm not saying that school staff isn't trained in general, but they're not trained specific. So their skill set, they may be using what they've been trained in. However, it's not working for certain students because the strategy you're using is a strategy for something else.
And just to Gay's point of, what we were trying to disrupt in my office, and Carrie and everybody on this call, we don't want to have specialists that exist, that are in a room where someone has to go and get a treatment and then hope it generalizes to the general education classroom. We need to have everybody understanding that this is a very different type of like I said, a brain injury, and understanding and identifying it and being able to work with that everybody needs information on that, and that's not just specialists.
Well, then I guess I'm going to make,
Oh,
Atlee,
sorry.
sorry. Go ahead. Please, you go.
No, I was just gonna say, I agree. The first one and this one that we're talking about are pretty similar, but I think it's so important. I didn't flag that. But one thing, as people are talking about this, I remember being struck because I didn't do, I guess, the pre-work to figure out kind of how little money it is we're talking about that's going to go out the door on this. And I wanted to, with regard to this question, I wonder, like, one of the things about if you're giving out money, we know we can't address the whole problem, but we won't really incentivize some schools to come up with some innovative solutions to meet the needs of this population. I'd like the group to consider, and I haven't thought this fully through, but some sort of like system forcing measure, like in order to apply for this, like they have to set some sort of goal that's like, we are not, if we're looking at this population under age 8, it's already statutorily limited that we don't expel these kids. We're supposed to not suspend them for more than 3 days, although a lot of schools haven't gotten the memo. But that, like, a school basically say, we're going to apply for this training money, this support money, and we are going to eliminate the use of out of school suspensions for this population, or something, to where, because we could give, people need, there's so much need for training, and I forget who, somebody fell off the call, but the research showing that all the teachers are saying that, like, they don't have basic training for dealing with the behaviors that they're being asked to deal with. So is there some way to, like, we know everybody's going to need this, and if this is the way we go, which I think is a really good priority, is there a way to basically put some criteria in place to make people be really ambitious and to basically make it part of a process where they are going to basically say, we are not going to push kids out of school, period, and we're going to use this training as part of that effort. But I agree, it's good that it's there twice, because it's the most important thing.
Does it make some sense to group them even and just make it a bigger area, and maybe it's one of the larger areas in terms of where, if we're looking at dividing up the funding across some of these areas, that I just don't know. I don't know.
Uh-huh. I'm wondering, Carrie, do you want to go ahead? I see Carrie and Nancy, and then Nancy.
I'm just gonna say, I think with the training piece, we might be putting the cart before the horse. We have to work hard on identifying these students first and foremost. I mean, you could put training in place, but if you're not identifying the students and the teachers don't know where to use their training, then it's useless. And I think identification is one of the hardest things for this population that we have not answered for.
Nancy, did you want to add to that?
Yeah, I was going to say something similar. Is with some of this, we're making the assumption that these folks have been identified and are on the rolls of special education, which may be true, but oftentimes it is not true. I don't think there's a lot of kids who are having dysregulated behavior right now that are not special ed kids. And some of that, we need to have some training and technical assistance about identification. Who are these children? Who might be these children, and what might we do once we find these children?
So are you suggesting I mean, I don't know if this is in order or not, but are you suggesting that the training and identification piece that we're recommending go at the top, and then these intervention pieces follow? I don't know, Liz, whether that's important or not in terms of this chart.
I would just say I wouldn't worry too much about consolidating. I think at this point we're just looking to make sure we've captured everything, and then like there's no presumption of priority based on the ordering of this list, right? It's just like I appreciate the like how can we sort of work with what we've got if it's reiterated, but I would say at this point in the process it's really have we captured everything, right? Do we have a specific challenge and strategy for the identification piece, which are people are just naming? And I wouldn't worry too much about trying to collapse those at this point.
Yeah, that makes sense.
Let's make sure we got everything before we streamline it.
I wasn't on mute. You probably could hear my little strategy of tapping my fingers, my little ADHD here on a Friday afternoon. The other thing is that brings back to, I agree, the identification piece. I think we need to do some research into what is out there and are there valid and reliable evaluation and tools to use for the identification, because you're absolutely right. That is a significant piece to this.
And I guess for me as like an outsider, tell me all, are there already trainings that you all would be suggesting for schools that they have that is helpful for all sorts of behaviors that because I'm starting to get this sense that there's this like if you put the question of identification in and yet there isn't a good identifying tool yet, are there ways to still do training or deep coaching that would help schools do better now without necessarily having to if we end up not having a validated tool that could be used? I guess I don't want to like shut something out that you all might see as totally possible to do right now.
I mean, the limited research that I did kind of coming into our first meeting was like that, yeah, this is hard for all the reasons we talked about, because a lot of families aren't going to, I mean, you're just not going to actually be able to get the information to make a determinative, to determine that. And so it's like the interventions that focus on trauma and trauma informed schools are that seems to be what people do. I don't know.
I guess that's what I'm suggesting. Is there just like a deepening of those tools and resources and targeted coaching around trauma informed work that could be beneficial as people are trying to build the understanding and knowledge and tools for identifying?
Yeah, I think definitely. Oh, sorry.
Only if we can add, it's not trauma informed tools is coming at it from a different point of view. It's coming at it from a point of view of that there is a mental health disorder, that there is an issue, that there is a trauma that we're going to be able to provide emotional support for, and we're being gentle with. That's fine. This is a brain injury. So instead of trauma informed, is there much about brain injury? because knowledge and just a little bit of knowledge, if you say, I want to provide some training about trauma, that's going to yield a different result and different potential than I want to provide training about what the reality of brain injury is and how you might approach teaching. How you approach teaching trauma is going to be very different than how you approach teaching brain injury.
And is it
And I don't
both
think
though,
we talk
Nancy?
much about brain injury.
Well, I'm
It
just
could,
wondering,
I
is
was
it
gonna say
both?
that, Liz,
Because
it
we
could
have,
be both. I mean, I think the original injury is to the brain because the impact
It is
happened
a trauma.
in utero. And then if the child is still living in the home and the parents are still addicted, there is trauma around that. You have to identify both of those things for that kiddo to make sure, because if that child was living in an adoptive or foster family home, there might not be that trauma and they may never had that trauma and they just might have the brain injury. You have to make sure that you are providing the right intervention for the child in the right space. And so you have to identify that, which is why identification is really important. You have to identify, is trauma present before you provide trauma interventions for that student, because it may not be appropriate.
Yeah, I
And
think it's both. And even the trauma, even if they're not still living in trauma, some of that early trauma around withdrawing from addiction and whatever all of that early trauma looked like, that still is present in a lot of ways for kids. So I agree. I agree, Carrie. I think it could be both.
And I'm sure there are others out there, but one that's coming to mind right now is Dr. Lori Desitel, who does a lot of work in neuroscience out of Butler University. There's a significant amount of work that she's been doing on the nervous system, neuroscience. Um, I've heard she's been in Maine. We've heard her speak a couple of times. She's coming back to Maine. Butler has a course that they offer, a certification type program in neuroscience and that. So there are people and there are institutions that are doing kind of brain-based neuroscience development now.
okay, lots of good thoughts here. We have one more challenge that we identified in that first meeting, and that's workforce shortages and special ed are a specific challenge. And I'm wondering, we have one was really about a question of whether this is about recruitment and retention, and the other one is additional providers of mental and behavioral health in schools to assist with children with healing and repair targeted to ages 3 through 8. Do people have any questions about this or any thoughts that they want to add? Any research that we have that we want to add in here? Any additions?
I've been thinking a lot about this one because I hear from directors all around about staff shortages and then the need for behavioral and mental health providers. My worry is that this is not a lot of money and it's supposed to be ongoing. Um, and when funds go away, then that leaves it on local school budgets to continue positions. And schools right now have funding for providers that they can't hire because credentialed staff is not out there. And I worry about putting money to hire an individual when the individual isn't there. We can't create a person. That's my only worry with this one is that we could set aside money and recommend to have money and then not be able to fill the positions.
Any other thoughts on that?
I just wonder if there's a way in an RFP that we could ask someone to demonstrate that they had identified a partnership. Like I'm going back up to, I'm looking at alignment. So Liz, that second bullet in the 1st challenge strategy says interagency partnerships with community providers. I think it's a similar recommendation as what's under workforce. I'm just wondering if there's a way we could ask someone in the RFP to articulate if they'd already identified a prospect, right? Rather than allocating a resource to something that they haven't identified yet. We could just as a thought, in terms of making that priority, that we would ask folks to articulate the way in which they'd identified that was a real possibility for them.
And I feel for rural schools who probably this is a significant concern, probably would not be able to identify that. And would that then preclude them from being to have, very funding for other things?
Well, I think you're getting into prioritization there, Gay, right? So you've generated a list, but you might put that one lower on the priority recommendations to the council because of some of the factors that you just named, right? I think you all in real time are sort of making the case, the pros and cons or the challenges and opportunities with different strategies that you're identifying. So I think feasibility is a good question. And I think the council tends to appreciate when folks can share. It would be great if we have this, we have concerns about actually being able to implement it. We think these are more feasible, so we might put them higher on the list of prioritization. Doesn't have to come off the list if you think it would be helpful. You just might offer that narrative of feasibility concerns.
I want to give an opportunity for folks to add any additional challenges that you don't feel like are missing here before we kind of get into thinking about priorities and any additional sort of challenges with these priorities. Okay. So what I was thinking would be helpful here, I didn't want to, I'm now just doing a couple moving of all these strategies to down to the next section on prioritizing. And I thought what would be helpful is as we're prioritizing, I think one of the things we realized last time we did this with the prevention work group is that there's lots of ways to prioritize. It can be that you're prioritizing what's most important. You can be prioritizing what most fits this money and what's available. I think it's worth really looking here for a minute at the actual MOU one more time and seeing what are in the MOU, what are some of the priorities that the MOU outlines. Sorry, I'm just quickly moving some of these things. So I'm going to open the MOU really quickly, and it's a document that I'm going to share my screen for a second. Oh, Elizabeth, do you mind giving me access to sharing my screen? Because I want to just point out a couple of things here. Great, thank you so much. So this is the school MOU, but I think it's just important. This document wouldn't let me highlight, so I wanted to do some highlighting, but it's a document that cannot be changed, which I appreciate. But it says the Recovery Council must direct funding to educational supports. The Recovery Council will also aim to maximize impact and not attempt a pro rata distribution. Although these factors are not dispositive, the council will give priority in funding educational supports too. And I think there's a couple different sets here. There's who the population is and what the thing is, and then there's also a set of priorities here that are really around who's been most impacted, and we're going to get to that in a minute with looking at Melissa's going to share with us some data. But I think what's helpful here is to say within a school district that there are the applications, the priorities are given to applications that target services to children under the age of 8, where the potential gains are highest. You all have obviously were looking at these, so when you were thinking about this, but I just want to say it again. Applications that show that funds received will be used to leverage matching funds from other sources. That programs that can show they'll be self-sustaining once the grant money has been spent. Applications for funding for direct services to students. Funding is not for research. And then there's a part around innovation. Applications for projects that are innovative or designed to be replicated elsewhere. So I think when we're thinking about, I'm going to stop my share so we can see each other. When we're thinking about it, I think it would just be helpful to get like sort of a loose, people can go around and say like, which thing are you think is most important and some of your priorities. We can do an actual, more next time, do a more intensive sort of like, if we need to, a voting. I think we might get there just based on consensus. So I think it would be helpful if folks wouldn't mind going around and talking about, when you look at this list and what we just talked about, what do you all think are what would you prioritize? There's somebody that would like to start.
Since I jumped the gun, I'll just say again, like training to prevent push out of children from school.
Great, thank you.
I agree with I would say the training, and I would look at train the trainer model that could spread to other schools, either in that district or in the region or across the state.
I even think, before you get to training, you have to identify for people what this is. So I'm just thinking about kind of an informational module. I'm thinking about, and at the DOE, we use the engine learning management system, something along those lines. I think it would be a great idea to kind of first tell people about, what this is, how it impacts, et cetera, because I think that kind of informational campaign would be really critical even beyond the training.
Can I ask a question about that, Erin, real quickly? Because I think partly there's like prioritizing, and then there's also, we can put with this, here are some resources that are currently available that if you applied, so say we had schools that were applying to do, this sort of training and intensive coaching. When they go to apply, they're going to want to know, well, who could do that for me? Because we don't have the resources currently. We need to know who's out there, like what would we need to budget for that? Do you all have a list of those kinds of resources and training that's available to schools? Some of which might be free, some of which might be they might need to put into a budget for them to pull from. Because I think if we're going to choose this one as like a priority, it does feel right to have this group share what are some models and some resources available.
Yeah, I don't think we have that, but it'd be important to have that. So, and kind of in my thinking, I'm always like, no, I want to do that for everybody, right? And so, what am I going to do in my position to like make sure that everybody gets the training? So, I think what we could potentially do. When is our next gathering? Is it in a month from now? I'm just thinking maybe we can get an internal team with the school, student and services, and DHHS and gay, and just try to kind of pool up who people are relying on and who are experts within our state and who are experts we rely on out of our state. I think that'd be a great. I mean, because you're right. Like if I'm an SAU that's never broached this topic, I'd be like, well, where do I start? They're going to call the DOE and say, where do we start? And so I should probably have a list of what's going to happen. And, but that's going to take some, getting kind of an internal and even interstate agency connection, because I'm sure the CDC works with folks and that are different than educational folks. And so we just have to figure that out. So did you say it was in a month?
I don't think we actually have a meeting on the books.
Oh, okay. We don't have a meeting on this. Okay.
So we gotta do that before the end of this. But I don't think it'll be given our collective calendars. I'm assuming a month out seems reasonable.
Yeah.
Others have other thoughts on other things that could be that you would have as your priorities?
You're on mute, Katie, but I'm sure whatever you're saying is brilliant.
Thank you. I think that I agree with the training being the priority, and I just wonder about both bullet one and bullet three in terms of, training for the school psychologists and in terms of identification, and then also the train the trainer kind of about how to work with kids. So it's not one priority, two, but maybe they kind of go together.
Any other thoughts from folks who want to chime in? Okay. So I guess I'm hearing that there's really one or two priorities that folks have around this. Are there other, although these other things were identified as well, right? So it could be that, so we'll come back to what to do with these other ones. I think it's worth thinking about a little bit more before we like make some determination. I think another question that I think it would be great, Erin, if you want to think about how I guess I'm like, oh, interesting. If we choose this one and there isn't necessarily a training out there ready to go, or folks who are, and perhaps there are some in other states, right, where folks could hire somebody else from elsewhere who's figured this
Well,
out. But I think people are going to look
when I look at the opiate resources in Maine, they're all geared toward the individual user, right? They're not
Yeah.
about how to deal with children who have
No.
been impacted by these exposures. So, I work I have been working for a couple of years with this researcher who's doing this amazing work, and we've gotten all the school psychologists trained in how to screen and identify substance abuse disorders. But I'm thinking like, actually, we need a resource for this somewhere, like probably somewhere, right? So I think that's not something I'm going to do in a month, but I can certainly, Gay, you probably have some great resources. So I can gather some people who do this work and support young people in schools and say, hey, let's get together and, at least create a spreadsheet of who's doing what, who's on first, because again, there could be other initiatives that are happening. This happens all the time in state government, right? Like you're working on something that interfaces with something I'm working on, but I don't know you're doing it. So I think I just have to figure out who I would be meeting with it. But yeah, I'd be happy to kind of try to pull something together. Something like that is, again, not available to us in our state, in terms of that specific educational focus. But I think that we could at least provide some, like nationwide experts that could,
Yeah.
and like I said, there's a lot of interest in Maine because of our high identification rate for autism and the likelihood that that's being misidentified. So I know that there are a lot of people looking at Maine and looking at the trajectory of like, we have very, 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 very few children who are identified as under FASD in our state. And so anyway, yeah, I think I could get together. I don't know if I could do it in a month, but I'm gonna connect with Bear. Bear might be, I don't know, he might be listening. He might not have been available today, but I'll connect with him and Julie Smide's team and Gay and Carrie. Well, I'll just like get together and see if we can kind of at least come up with an initial list of who are the experts that we're relying on to support schools when they come up with this. And I think really like at a very basic level, people need to know how this is a brain injury, how it differs from other types of disorders, and how that might show up differently in class. Because, I know that in my work with my this researcher that I'm working with that, under 10% of children with fetal alcohol syndrome have any kind of facial characteristics. So that means 90% of children with fetal alcohol syndrome are, I mean, I'll just say that most of our parents might have drank some wine. We don't know. So there's no telling like what how to identify these things, but the behaviors for them are very typical. So anyway, yes, I will do that.
Nancy. Oh yeah, great. Nancy, I can see
I
you
just dropped in the chat. I've worked with Dr. Douglas Waite before, specifically about substance affected youth and children. And the challenge is he's a developmental pediatrician. He's done some phenomenal research. He is an absolute expert, but is it connected? It's like, is the field right? That's the problem, because if the developmental pediatrician and the American Academy of Pediatrics is trying to figure out what is the trajectory and how do we provide treatment and what's out there, at the same time as educators, I think you have to do this hand in hand. So I would be bringing the developmental pediatrics into this as well. I wouldn't want to just have somebody focused on education, because there's
No,
it's
that's a
it's
great
really
point. That's a
it's
great
both.
point. And I do meet periodically with developmental pediatricians in the state. Um, is that Dr. Waite from Boston area or
No, I
someone?
believe he's from, where is Doug from? There's another person
I think I've met with that person as well.
I think you have.
Yeah.
He was here. He's from New York. He's
Yes.
from New
Okay.
York.
Yep. I have met with him. Yeah.
Yeah.
So absolutely. That's a great point, because there's all different, like, again, sometimes pediatricians, like pediatricians in schools sometimes don't work well together. So it'd be great to bring everyone together. I agree.
Yeah, and I think that goes back to that interagency piece that we had as a priority, perhaps. So, yeah.
Great.
I was also wondering, Liz, and this is kind of wordsmithing a little bit, but if we're looking at priorities, bullet 3 and 4, I kind of read that as the same thing. And would it be better to cut down the number of priorities? Because if you're talking about better tools, if they're available for this identification, that would mean school psychologists and those doing the evaluations would need to be trained in those evaluation tools.
Yeah, I appreciate that. I think that's an easy.
I think that, I did do that one training. I think we could, I know that they, in the school psychology program, I know they're churning out about 50 more school psychologists. So there's more coming into the field, which is so exciting. But, and I know that they, kind of touch that, broach that topic. But again, it's very specialized. So I do think like additional trainings would be important.
I'm great. This is a great discussion. I'm mindful of the time and wondering if Melissa, you want to take on this next challenge of thinking about how we narrow the scope around who's prioritized, most impacted. Because given that it is a small amount of money, how do we help the council decide what's some criteria for most impacted and potential data sources? So I'll turn it over to you, Melissa.
Yeah. Thanks, Liz. I actually think the conversation was a good segue to that. And as I was looking at strategies, a lot of the strategies say impacted by OUD. It would be helpful for us to think together what we mean by that. And I think some of you were touching on that in various ways, right? Is it focused on students and children who have experienced neonatal abstinence syndrome? Is it students and children who have been impacted by OUD related trauma from the loss of a parent or caregiver or use in the home? So I think those are going to be some of the things for you all to think about in terms of, again, prioritization for the use of the funds. And I just want to say, as I say that out loud, I know how hard that is. Like I think we all, I hope, share a desire for all of those children who've experienced those different kinds of exposures and impacts to get the support that they need to be successful in school and life. And I also recognize that, as Atlee said at the top of the meeting, it's not a ton of money. So I think it is going to be important for you all to really give a strong recommendation to the council about how to most effectively target this resource. With that, I'm going to turn my video off because I'm experiencing some internet lag here, and it'll be better if you can hear me, but not necessarily need to see me. A lot of you have touched on what I would have wanted to share just high level. So just for some context, the Maine Children's Alliance also has a data and research person. We do the Kids Count data book every other year and also track a bunch of indicators related to child and family well-being. I asked that staff person, Kinch, to do some outreach and data collection to help just share some information and food for thought as we think about how we are currently identifying young people who have this exposure, children who have this exposure, and then also thinking about what early intervention looks like and special education, just to really understand, I think, that kind of pipeline, because as many of you have mentioned, as was reinforced in these conversations, there are challenges to identification in the hospital, connection to early intervention, and that information carrying through an IEP. So I think you all have touched on these things, and I just would want to offer some data and information to share that. I would say there are a lot of limitations with the data, and I'm going to underscore that as we're looking at them. Lots of different conversations that I've been in where folks are just naming, and I just want to underscore the stigma that parents experience in using opioids, having that affect their infant and having that identification made, and how then that follows them in terms of the child getting the services that they need. So just want to underscore that that's a real contributing factor that we need to think about. And I appreciated where folks were really thinking about how do we really have a trauma-informed approach and really seek to destigmatize that experience, because that is ultimately going to help us best serve those students. That's enough editorializing for me. So again, just starting with that neonatal abstinence syndrome as a result of exposure to certain substances during pregnancy, is really most often identified through hospitals, through birthing hospitals. And it feels worth mentioning that I think, as many of us know, a lot of birthing hospitals in Maine have been impacted by closures. That affects the way we sometimes can understand where a family is living and where they're giving birth, and how that data is collected and understood in terms of where that child will then actually be getting services and going to school. So that was shared as kind of a pain point in understanding some of the data. I think I've mentioned to this group, I'm also part of a work group working on substance exposed infants with the Office of Child and Family Services. There's federal law that requires hospitals to notify child welfare when there's an infant born exposed to substances, and that's been identified by the hospital. And many of the hospital partners that are part of that conversation have shared a challenge with consistent identification of that. So substance exposed infants is a bigger population, right? Many different substances, not just opioids, but challenges with identification consistently within and across hospitals. So I think not news to this group who's already named the challenge with that, with identification, but I would just underscore that it starts as early as at the hospital. And then those referrals being made for early intervention. The early intervention for me team talked a little bit about how, sometimes those handoffs are really effective. Sometimes we run into that stigma again when the referral is made and a parent answers the call to get connected to these services as a result of that exposure. So just, again, underscoring the stigma as a challenge to identification and connection to services was named by Maine Department of Education and Early Intervention for me and these hospital providers in these conversations. I just want to share some high-level data points. Getting into a county or sort of district level with some of the community conditions is fairly challenging, as well as sort of the substance-exposed infant data. But at a high level, historically, Maine has had a higher rate of babies born with NAS than the national average, especially in rural areas. Back in 2012, Maine had the second highest rate in the US per CDC data. So when we think about those children being born and then where they are in the special education sort of pipeline, food for thought there. I'm also happy to share out this larger brain dump. I'm just sort of capturing data points that and context that I think is either emphasizing what folks have said or maybe a gap. I think Liz also shared some data about impact. Maine was ranked 9th recently in the nation for the rate of children who are affected by the opioid epidemic. That obviously has lots of different parameters. But just thinking about those, again, those sort of lifetime costs associated with healthcare, special education, and possible child welfare and criminal justice involvement. I think you all are experts in kind of understanding the disability landscape and where that fits in. But just for the purposes of sharing, having a shared understanding, we did pull together some special education data, which I will endeavor to share. Everyone see that okay? Okay. So looking at a pretty high level here, in 2025, 34,951 students, or around 20.4%, were identified as having a disability. And you can see the percentage by county here, with apologies that I did not have time to actually put the counties in. So it's a little geography quiz for everybody to identify which county is which here. But again, this captures a variety of disabilities, not necessarily those that we're talking about in this particular context. As we look at the special education population over time, in the last 10 years, Maine's experienced a 16.8% increase in students identified as having a disability. You see that trend line there. And again, just naming that those are a variety of different identifications in the special education population. And then we start to get into the more detailed, you can zoom to if that's a little small. Maybe. No, I can't zoom that much. Oop. I can share this out, but I can also read it. So this is by county by disability for 2025. And you can see the categories there. As I heard in the conversation, you know, even taking these categories with a little bit of a grain of salt, as we've heard people saying, you know, that sometimes the identification of being impacted by opioid use disorder may not be captured accurately in the special education identification. But I can share these out. Just wanted to give kind of a high level for folks about what we're looking at in special education. And then also wanted to just go back a little bit and look at babies born substance exposed. And again, this is going to be more substances than just opioids, but to give you a picture, literally. So this is the percent of babies born substance exposed. This is 2024 data. I always ask our data person, and I get really annoyed when other people don't do this when they share the data, to really think about what are the substances we're talking about, because the most common substance is cannabis, followed by buprenorphine or Suboxone and methadone. So I think often when people think about babies who are born substance exposed, they might have a misconception about what substances we're talking about. Those are the most prevalent substances that we're looking at. And you see there's pretty significant variation by county here. And this is by residents of the family. So you're not looking at birthing hospital data here. You're looking at that mapped to where the family actually lives. And then I think some good news there to look at, you know, as you look at the sort of inverse of this, right, was the special education diagnoses going up over time. We have seen the rate of babies born substance exposed going down over time. I'm just going to scan through my notes again to make sure I captured everything that folks shared with us in comments. And as I mentioned, I can share this out as more of a kind of information for you all to read through in more detail. But again, as we're thinking about the number of babies that are born substance exposed each year across substances for 2024, that was 527 babies. And then, of course, I think it's important that we're really thinking back longitudinally at the numbers of babies who are born substance exposed as they are becoming school aged, as they may be engaging in special education services, and thinking about from that map where certain counties are more impacted than others. I think Aaron, or it may have been someone else in a prior meeting, mentioned this, but it feels worth naming again as we think about the role of stigma and understanding and appropriately identifying. When we talked to the early intervention team, they shared again that parents can sign a waiver so that their early intervention information can be shared as part of the IEP process, but they do need to sign a waiver. So it does create that challenge in these places where families are engaging in different services and different systems, and how the information carries forward or not, and how that helps us really make the most appropriate connection to the most appropriate support. Nancy, I saw your hand. I was just scrolling back through to make sure I covered everything, but it's a long document, so I think I covered the highlights.
I want to make sure, because, when I first look at that county chart, I think, okay, well, we know where to put the money, but we don't necessarily know or do we know if there is a correlation between the substance affected disorder and child find, whether or not they're actually being identified as actually having special education. So, when we're looking at the most need, you were saying, is there a different kind? Is there a different number of, is there a substance that they're being born with? Just because one area might be heavily identified in a substance, is that necessarily the substance that's affecting the children the most? So is there a correlation between the special education children and where they're being born?
I'm not going to answer that question, Nancy, but I think it is a good question. And I think, Aaron, you're obviously welcome
I'm
to
like
speak.
I'm trying to digest that question
Yeah.
and figure out how I would find that information. The biggest diagnosis in Maine, the biggest eligibility category is still specific learning disability. So, I would say that is an impact of, it could be an impact of, opiate exposure, but I don't know. We definitely report on identification rates, and we have data support that you could look by district and see who's identified as what, but I don't know that there's any way to correlate. Just not in the data that we gather at this point.
I suspect that is true. I was thinking, because all of those folks, it's a mandatory referral to CDS. So it's a mandatory referral to child find for Part C, but it's not necessarily, those kids in Part C might not be continuing through, or they may go in and out. So I'm not sure if we're robust enough to be able to track the connection between the referral source for when they were referred over and what their needs were as they tracked. That would be the only way to correlate.
One of the things that's an advantage for us is our Part C is in the Department of Education. So that means that we have, access to data. There is actually, it's mandated that we, and again, Maine hasn't followed this policy because it wasn't in compliance. We found this out. There is a mandate that says that we have to hand over certain information from Part C if a child was in Part C to the SAU. And it wouldn't be all of the medical records, because the records that we keep in Part C, frankly, are more like medical records than they are like educational records. And then if parents want, they have to opt out of providing that kind of global information to our school systems. But I think, we do have really robust child find in Part C. We worked really hard on that for the last 5 years. Our rates have increased. We certainly have that great pipeline from DHHS and from medical professionals once children are exposed. So I could bring that to our Part C team, because, I work with them, which is so convenient, and just say, hey, how are you gathering this data, and what are the percentages? I can just kind of try to kind of tease that out with them if there's any way to kind of understand that.
Aaron, can I ask you a question? You said the biggest diagnosis for special education is, and I didn't catch.
Learning disability.
Oh, learning disability.
Learning disability. Right. And so I say that because these children aren't being identified as
Right.
having an opiate, you know, like they're not
Right.
being, and so, and that's the, you know, the skill set that we have to provide our educators and people who are evaluating children in order to be able to, um, you know, really tease that out, you know. So again, I think it's just worth talking about in part C if there's anything that, you know, you know, their awareness of this, I think is critical. But yeah, I'm kind of thinking out loud about, I'm just thinking out loud about how to kind of correlate some of this data.
Yeah.
Because
Well, and I
all
guess I
children
wonder,
in
is there,
Part C are under the same categorization. They're all under developmental delay. So
Right.
nothing is like their developmental delay if they have, you know, a chromosomal disorder, or if they have opiate exposure, or if they have a speech impediment, whatever it is. So that's why it's challenging. But again, it's convenient that they're in the Department of Education because we can collaborate.
Yeah.
I was going to say they used a couple in the national settlement funding. They used like a couple indicators to try to help schools to identify who was kind of at higher, most impacted. So I wonder if there are a way in which there's like a triangulation of data that could be used for schools to identify some of the ones Melissa identified, and perhaps information you have at the DOE could also be helpful for schools to access that data and then say, this is why we think we're at higher and higher, we're a higher impact school, SAU. I think we just have to figure out how do we help the council like with deciding this, because they are going to have, I mean, just as somebody on it, I'm like, I would have no idea how to do this. So
Yeah.
this group deciding that would be great.
The other thing I want to add is that there's a category in the MOU that's, again, it's areas hardest hit, right? So there's like the student identification, there's the child identification, and then there's communities hardest hit. And that data tends to be more challenging to identify, right? As I mentioned at the beginning, are we talking about children who've lost a parent to overdose? That data you can sometimes find at a statewide rate, but not at a county or an SAU level, certainly not. So thinking about just some of the limitations with the data that we do have, the National Trust used NAS data, and I will just say, talking to hospital providers, there was some caution given around how well that identification is happening. And really, you know, that the hospital is sort of in the best position to make that determination, that make that identification at birth. So how we are, I think, just wanting to demonstrate with that data set, if you track it back to that NAS data, where you might lose students along the way, right? In how they're categorized, in information that's shared or not shared. I don't want to say there's no good data, Liz. I'd rather offer grains of salt and say, like, this is the definitive data. Like there's lots of constraints in how we have a really solid understanding of this population. And there's another criteria in the MOU that does also talk about possibly prioritizing based on school. I'm not going to get the language right, but schools with less resources, right? So that is another way to consider prioritizing.
Yes, it's poorly funded school administrative units or school administrative units with low per pupil spending.
Yeah. So just some considerations in terms of how to identify quote unquote areas most impacted by the opioid epidemic, which is a challenge. Any other, Aaron, I really appreciated your comments, and I feel like we gave you a lot of homework from this meeting, so with apologies.
No. I have the most homework of anyone. No,
thank you for being here and offering to bring people together.
You know, this is something I've been working on for a long time, because I do feel that people are under identifying this impact and also not understanding how to respond in a way that's helpful and also like ethical and, you know, evidence-based, because I do think a lot of these kids are misidentified and misunderstood. So it is what I'm doing here in Maine.
Appreciate your expertise and willingness to go off and bring people together and try to do some brainstorming around data and around different tools and strategies. Liz, do we want to do the RFP considerations while we still have time? Do we feel like we have time to dig into that?
Can I just ask one question? The slide deck where you had all that data, this is all in our document, correct? It's going to be uploaded into our document.
It's not there yet, but it can be there, or I can send it as links. I think let's keep it in the document.
I think the document is great because then we don't have another email.
Yeah.
Yeah.
Totally. Happy to do that. One place is really appreciated. I know I got all the really fun topics. I get to talk about data and the RFP. So I'm kind of chuckling as I say that. So I'm trying to go back up to, I feel like I had pulled it up. Okay. So I'm going to share my screen again, unless that makes people dizzy and drives them crazy. Speak now or forever hold your peace. As we think about, so just to sort of recap where we are, where we're going, you all, I think, did some really great work. I even felt like from the first meeting, you were all circling on similar challenges and strategies, always affirming to find folks similarly on the same page about what the challenges are, what the opportunities are. We'll continue to prioritize within that around the populations and prioritization of different strategies. If there are additional data points that folks would think would be helpful, I'm happy to put my data and research person on it, or to ask Erin if she might have access to data that would be helpful as we think about the population or community impact. And then finally, we really want to think about the RFP for this grant opportunity. And Brendan was kind enough to gather this national opioid recovery trust information, and that there's a couple places where we've linked to information that might be useful to you all in that Google document. But in particular, we just wanted to lift up this RFP. This is the RFP that national group used. Our sense initially is that it does fairly well align with the purposes and scope and some of the populations that we've talked about, considering for the Maine Recovery Council settlement funds. And so I'm not presuming that everybody's had time to read this 24-page document, but I just would lift this up and suggest to folks, if they have taken a look at it, if they feel like this might be a place to suggest the council start to draft an RFP, like, is this a model? If folks have looked at it, if there are, if you found that there were things that we might look to or concerns that you had about this, and I would say if folks haven't had time to look at it, that could be some homework between now and the next meeting. But again, just thinking about how we can, as council members, Liz and I are very aware of the volunteer nature of a board trying to also be a working board. And if there are opportunities to say, hey, this is a good example, that also takes pressure off the staff to kind of create these things. So wanting to get it right and also not wanting to reinvent the wheel if we don't need to. So I'll just name for folks without going through it. You've got the summary at the top. It outlines the funding, sort of the uses of the funding, the maximum grant value. It gets into the idea that you have to, that it can't supplant funding. It gets into the details around the eligibility. And then it lists out certain types of grants, district improvement, model program, and best practice and innovation. I think we've talked about different examples of these. And then it gets into a lot more detail about some of the boundaries and the more specific details of the RFP. But I would just welcome if folks have had a chance to ponder this, if you have any feedback, and if you haven't had time to ponder it or review it and you want to, and then get back to this question at the next meeting, that is fine as well. We've thrown a lot at you today. I do think one of the questions that we have is around, as you're identifying, it may be helpful in the context of identifying different strategies or priorities, like how much would an SAU need to have to actually implement something and have it be effective? And I'm thinking particularly, as many of you have leaned into, it's not a one-time training, it's sort of intensive, train the trainer, technical assistance. That's obviously going to cost more to do across the school, an SAU, than a sort of one-off. So we'll just be asking you to keep that in mind too, about I think the council has always the best interests and wishes at heart of like giving out to as many people the money that we can, but also wanting it to actually be impactful. So thinking about what that minimum or maximum dollar amount might be within the scope of what we have for this grant opportunity.
And I'm struck when in thinking about this grant, what's laid out in terms of the topic headings that they have and our priorities, there
Yeah.
is a way in which we could, I think it's worth thinking about um, how to make the topics the priorities. And I do think having an innovation one could also be a possibility where we don't have the answer here and allowing for an innovative one, but it would require, folks to have provide some evidence as to why they would be doing an innovative thing that's not in the others. I will say as a member of the council, like, I think part of the reason, though, the headers or like the topics that schools could choose from for that national one, they're too broad. It's too much for the council to be able to work through like what's evidence, what's most useful. So I think that's why we wanted to narrow the scope with this group to help the council narrow and become a little more laser focused to actually make impact.
Thanks for lifting that up, Liz. I think that's really important, right? Sometimes there's a desire to have it be wide open. I think what we found is like the more specific, what's happening specifically in Maine, what's our expertise about what's happening in the field, and how does that guide being particular about what efforts are going to be most effective. I would also just name that I think, that document has a pretty detailed scoring rubric too. These are all things that the staff of the council ends up needing to do as part of the RFP process. And so if there's a sense from this group that it's pretty on target or it's missing things, it's just getting your sense of if that's a helpful place to start in terms of developing that. You guys are so good to be with us until 4 o'clock on a Friday afternoon.
Totally.
I'm hoping that Carrie's walking on a treadmill.
Yes,
That is such a good idea.
I've
I'm
had
also
like back to back to back to back all day, and I'm like, yeah, I'm going
oh yeah,
upstairs.
me
I gotta
too.
put the
I should
computer
get a
down,
treadmill and
treadmill, and just do a couple steps. So yes.
I'm just gonna also check with my national technical assistance teams to see if there's other states out there who are, kind of doing something similar and how they're kind of approaching it. Just to see if we can get, I love borrowing good ideas from other states that are in similar situations.
Yeah.
And
Erin, I never want to be the first to do anything. That's my policy take is like, I want to be like the 7th one. I want to be cutting edge, but not the pioneer, right? Like somebody else can go ahead of me and stumble on the things and tell me how not to do that.
Exactly.
Well, I'm wondering I'm sure people are going to have to go here in a minute. So I'm wondering if that was a lot. So we have a lot to think about. I think, Melissa and I'll probably meet again to just sort of run through what we've done and send out again, some like the next agenda of what we'd want to do in that last meeting and kind of what we'd want, your input on in this last meeting to kind of set those priorities and offer up some ideas for the council on how to prioritize which areas, which school districts. So do we want to just quickly try to schedule? That was really amazing how well that went last time. I can't believe it.
Don't jinx us, Liz.
I know, I'm sorry. I'm wondering if we are heading into that issue of February break.
When is February school break for people?
It's the 16th. I'm wondering about the 13th. I know it's like so tough to go the day before a break, but we could also go the 27th of February.
I can't do the 13th. I could do the 27th.
How does the 27th look for folks?
And suggesting a similar time, Liz, 2 to 4.
Yeah, it would have to be in the afternoon for me, but I could do the 27th. I can't do the 13th.
Okay. How about other folks? Does the 27th work?
Yep.
Can anybody not do the 27th who wants to?
Okay. Yeah, if you don't want to, we understand.
What time on the 27th? Sorry, I was.
Does 2 to 4 still work for folks?
I can make that. I might be on the road, but I can make it.
Okay. Wow. Amazing. Let's book it.
May all of our scheduling coordination go so easily as that.
Oh my God, seriously. It's like unheard of. I guess it's because we're picking a horrible time, but I appreciate you all being willing to do it for this. Okay, well, we will be in touch with you all. Thank you so much. And I hope you have
Thanks,
lovely,
everyone.
lovely 3-day weekends.
Thank you. Bye.
Bye.
Bye.